Welcome to this tutorial on pediatrics. So with pediatrics, today we are going to tackle the part that we left when we were discussing last time. It was under stages of physical growth and development. So under stages of physical growth and development, we say that it's very much important that the growth of a child is according to stages, and it is monitored as per milestones. Okay, so like we said that a child and once a child is born, they undergo stages until they are now matured enough that they can start doing things for themselves, or maybe let me just say into adulthood. So there are a lot of things that are involved. And when we're talking about pediatrics, it's very much important that we note the development of a child, because this is the only way we can keep track of the child's health, whether the child is okay, whether the child is not fine. So this is what we are talking about, the stages of physical and growth development. So under this, we looked at we said that growth and development occurs in predictable stages, meaning that there are some specific periods when we want a change in someone's growth, each characteristic physical, motor, cognitive, as well as the social changes. So all these are parameters which that shows growth in a child. Okay, so I said understanding these stages will help a nurse to know whether the child is growing well or they are not. Okay, so we looked at the many stages of development of a child. We said that we have a neonate, we have an infant, and we have the child, and we have an adolescent. Now what we want to know is to see as what stage we want to discuss each and every stage. So in pediatrics, most of the MCQs will come from these stages, basically on the physical growth and development. They will also want to find out about these milestones that the child has to achieve. So it's very much important that you have sound knowledge about the development of a child, because this is the only way you can know whether the child is growing fine, whether the child is not growing okay. Okay, so as we go on, you'll get it. So in the previous one, we looked at a neonate, and we said a neonate is the physical growth. We want to look at the part physical growth. So average birth weight is 2.5, and we said first very much important point here. We said that a neonate is a child with the days of from birth to 28 days. That's what we say. This one is a neonate. So if someone is just born today, until they reach their 28, that's when they can only be called that it's a neonate. So these are parameters which they should have. Length 45 to 50 centimeters. Head circumference should be larger than the chest circumference that we discussed in the last session. And we also said that the weight loss of up to 10% in the first week is normal, and I explained all this one. Okay, we also looked at the developmental characteristics, what happens to a neonate. We looked at the reflexes present. We looked at the sucking, the rooting, the moro, and the grasp. So you should know these reflexes, just like the way we discussed them in the previous session. Know them, know that way, because they'll ask you about these things, and you should not go without answering. Okay, they have limited voluntary movement, meaning that a neonate will not have a lot of movements, because most of the movements are made by the parents. They are only be turned. Now they are tired, you turn them the other side. That's how it is. And they sleep most of the time. That is about 16 to 20 hours per day. It's totally cool. And then when we look at the nursing consideration, we say that you need to maintain warmth, you need to support breastfeeding, you need to monitor weight, reflexes, feeding, and you also need to prevent infection. How do you prevent infection? Do not allow a lot of people to touch the child. Okay? So now we want to look at an infant. Who is an infant? An infant is a child between the ages of 1 month to 1 year. Okay, so the child who is in between 1 month to 1 year, that is going to be an infant. So you should know these age ranges because they are very, very, very much important. Okay, so you should be able to know that physical growth of this particular infant is that the birth weight doubles by 5 months and it triples by 1 year. So if the child was born with if the child was born with 3 kg, by the time they reach 1 month, they reach 1 year, they would have multiplied it by 3. It would have been 9 kg. Okay? If they had 2.5, multiplying it by 3, they would possibly have around 8 somewhere or 7.8 somewhere. Okay? So you should know these parameters. And then the length increases by about 25 centimeters in the first year. The length, we're also talking about the height of the child. They should at least reach 25 centimeters in the first year. And the head circumference increases rapidly in the first 6 months. The head circumference increases rapidly in the first 6 months. So within this period, the child is tend to the head circumference tends to increase. Okay. So what are some of the developmental milestones that this child is going to experience? We are talking about an infant. So infants, most of the time is that by the time, remember we're talking about 1 month to 1 year. That's what we want to describe. What is this child capable of doing? Because it's only when we note this, that's when we are going to know whether the child is growing well or is not. That's when we are going even to know that the child needs medical attention. So now developmental milestones, by the age of 3 months, the infant should be able to lift their head. They should be able to also occasionally smile. Okay, an infant should smile by the age of 3. Lift their head. So what does it tell you? Whenever these things are not being done by a child who is 3 months, it means that there have been developmental delays. That's what we mean. So these developmental milestones, they are more like stipulated time when something should be done. Just like the way in life it is that by the time if it's a woman, by the time you are turning you are in your 26, 27, you should be able to get married. At 45, you have menopause. That's how development growth occurs. So by the end, by the time the child is reaching 3 months, it's already an infant. They should be able to lift their head. They should also be able to smile. By the time they are reaching 6 months, they should be able to sit with support. Okay, they should be able to transfer object, moving object, one object to another. If at all you buy them toy cars, they are able to move it from one side to another. That's what we mean. By the age of 9 months, they should be able to start crawling. Okay, moving with their knees. 9 months, they should be able to move with their knees, be able to stand with support. That is 9 months. By the age of 12, that is 1 year, a child should be able to walk with support. Okay? And be able to at least utter 1 to 2 words. They need to say something at least 1 to 2 words. So this is how life has been stimulated on growth, how growth should be monitored. Okay? So those were developmental milestones for an infant. And we have reached 1 year, 12 months there. So these are what a child should achieve by the time they are reaching 12. What are some of the nursing consideration? The nursing consideration is that you need to promote exclusive breastfeeding for the first 6 months. They should be able to feed by the breasts. Okay? The one important thing I want to teach you here is that the child's immunity is not strong enough to fight foreign substances, foreign things that are entering the body. So what will happen is that once you start giving them food before they reach 6 months, that food, we cannot trust you with the preparations. Maybe you use contaminated water, and once it enters the child, they can be infected. So that's what we mean by let the child reach at least 6 months. That's when you can now introduce the supplementary feeding. Something that is nutritious, like soya beans, porridge. That's what we mean. So you can introduce complementary feeding at 6 months and be able to monitor immunization status. Is this child immunized against all the vaccines that they should receive by the time they are reaching 6 months? Are they fully immunized? You as a nurse. And also educate the parents on safety. So these are some of the nursing considerations. Let's go to another parameter, a child. A child, who is a child? A child is someone who is a year old until they reach puberty. So now puberty is reached around 13 years, 12 years. Okay? That's what we are describing a child. So under child, you should be able to note that under the same child, we have also subcategories. We have a toddler, we have a preschooler, and we have the school age period. That's what we have here under the child. Okay? So now we want to look at the child who is 1 year to puberty. We want to discuss what they should do, achieve within this period. We have a toddler. A toddler is someone who is 1 year old to 3 years. Okay? So now, how is the growth of a toddler? Someone who is 1 year to 3 years. The growth of a toddler is that they have a slower growth rate as compared to an infant. An infant, remember we said someone who is 1 month to 1 year. So their growth rate is slower than an infant, and then they able to gain weight to about 2 to 3 kg per year. Okay? And then when we look at the developmental milestones, a toddler should be someone who, because now they are 1 year. Remember, an infant who was 12 months was walking with support and be able to utter 1 or 2 words. But this person now, a toddler, should be able now to walk independent. Okay? That's why these toddlers are very dangerous. If you're not careful, they are able to hold things. They can even bring a frog. They can even bring frogs into bed. They can even hold snakes at this age. So they are able to walk independent. Okay? They are able to eat by themselves. They also use some simple words that they are getting from the folks. Okay? This is a toddler. We said 1 year to 3 years. It's very much important that you know these things as a nurse. Because when you say a 7-year-old neonate, that won't look nice. You should be able to know that a neonate is someone who is just born until 28 days. So you can't say 6-year-old. I'm reporting on a 6-year-old neonate. Okay. So what are some of the nursing focus? So these nursing focus are looking at the development of a child. What are they capable of doing? And then now you come on. Injured prevention. They are able to walk. They are able to go near things. They are able to go near kitchen units. they are able to reach the height of the stove. If you put water on the stove and it's boiling, make sure that you keep that room out of reach of these toddlers, because they can go there, and because they're able to walk freely and be able to pour that water and then it pours. And this is the most problem that occurs. This is the most dangerous stage, because this can do anything, you get. So you need to prevent injury at all cost. You find that in the pediatrics ward, there are a lot of children with burns. Why? Because these children have attained the age whereby they're able to walk by themselves, and you should prevent them from all that. Okay? Prevent them from injury. Also train them to use the toilet, because this is a critical stage. If the child misses this stage, it means that they will never be clean ever. They will be dead. So utilize this stage as you can. Nutrition education. You want to educate the parents on what the child should be eating. Let them eat nutritious food. Buy them balanced diet to support their growth. So that was a toddler. We want to look at the preschool. The preschool child. So preschool is someone who is 3 years to 6 years. Okay. So usually preschools, there is an increase in the height as well as weight. Okay, it's noted there. And then there is improved muscle coordination. You know, muscle coordination comes about in improved muscle coordination. That's where now they perfect their speech. They're able to talk well. They're able to walk. They can run. You get it. So that's what we mean by improved muscle coordination. At this particular time, they will even bring water for you. They can do a lot of things. You can send them, they go buy things for you at this particular age. Okay. So this, like I said, improved muscle coordination. They're able to run, they're able to jump, they're able to climb. Okay. They're able to speak, they're able to think. Okay. And they are able to play with other children. Okay. So what should be the next thing focus? Next thing focus should be tailored on health education. Okay. So on health education, you teach the parents on involving this child in health habits. Okay. Health habits. Make sure that they are not eating dirty food. Make sure that whenever they are sick, you take them to the hospital. Make sure that anything, all those things. Encourage play and socialization. Allow them to play. Allow them to play. That's they have reached the developmental stage. Let them play and let them talk to fellow. Okay. When you go in psychology, you say that this critical stage is a point where a children you should not disturb this stage, because once you disturb this stage, it will come with consequences in the future. If you don't allow them to socialize, their only home, there are those children who grow to be lesbians or gay because they don't know their sex and there are others. So let them socialize. Let them. That's when they're going to realize I'm a lady. This one is a boy. You get to know those. Okay. You need to be able to monitor vision as well as the hearing. At this particular time, the muscle coordination is completely fine, and you should be able to note that they are able to hear clearly and they are able to see clearly. Okay. So we are now looking at the school age child, someone who is 6 years to 12 years. Okay. You should be able to know that at this particular age, there is slow and steady growth. And usually most of them loses their primary teeth. So primary teeth are those first teeth that are going to develop. First teeth that are going to have. They tend to be lost at this particular age. Okay. And at that particular time, there is development in the logical thinking. They are able to analyze things. Okay, at this age, they start analyzing things. Okay, they start thinking. This is a time when they start realizing that dad doesn't love me, mom doesn't love me. At this particular time, if they are just children who are being kept, they can even realize that they are not being loved because their parents are dead. What? So at this particular time, there is logical thinking. Okay. So now there are some normal stressors by developmental stage. So what do we mean by normal stressors by developmental stage? We mean that there are some things that keeps there are some things that makes or becomes a worry for these particular children in all categories that we've described, from the neonate going to an infant up to the school age. So there are some fears or maybe things that comes to their attention. There are some worries they develop also. In other words, so when you look at the normal stressors by developmental stage, we need to look to know that the neonates, someone who is just 1 day, let me say 1 second to 28 days, that's what we are saying. They have fear of separation from mother. What will happen is that immediately they realize the mother is not there, they start crying. Okay? They also don't like being handled. They don't like moving from one hand to another hand to this hand. They don't like that. They are also allergic. They don't like loud noises. That's why when the child is born, you need to avoid loud noises. They will start crying. That's how they are going to respond. So immediately separate them from the mother, they are going to start crying. You start touching them. This one touches them, what? They are going to cry. Loud noises, they are going to cry. Now, when you look at the infant, what are the normal stressors for infants? So when you look at infants, they have anxiety for separation. The infant immediately, we are talking about someone who is 1 month to 1 year. These children, they don't like being separated from their parents. They have that anxiety. Okay? Immediately, let's say they come to the hospital and you are attending to them without their parents being there, they will start looking in the mother's direction until the mother is there. You can't do anything until the mother is there. That's the anxiety they have. Okay? That anxiety usually comes because they have a stranger anxiety. They don't like being surrounded by the strangers. And then when you go to the toddler, okay, to the toddler, we said 1 year to 3 years, okay, 1 year to 3 years. So this toddler, they have stress, fear of loss of autonomy. Okay, they don't like it when they lose their autonomy. Let's say if they are playing with their toys and then you shout at them, stop playing here, or you get those from them, they feel like someone is controlling them. So they don't like it that way. Okay? They like it when they are governing themselves. And they also have normal stressors of restriction of movement. They want to move. Okay? As well as separation, they also have. Okay? And then when we look at the preschoolers, which are usually the preschoolers, they are in the ages of They are in the ranges of 3 years to 6 years. Okay, 3 years to 6 years. They have fear of bodily injury. They have fear of bodily injury. They have fear of being harmed. They have fear of being punished. Okay, and they also have imagination based fears. Okay, so these imagination based fears, they start imagining, they start thinking about things, and then they develop that fear. What if mom goes? What if mom doesn't come? All those things. And then the school ages, now we are talking about someone who is now 6 years to 12 years. 6 years to 12 years. The normal stressors is peer acceptance. They want to be accepted by friends. They want to be respected. Okay. They also want to do well in school. Okay. And they want to be good at things. Loss of competence. They want to be good at things. Immediately they lose this, then they start being stressed. So they don't want to lose competence. So this is all about today's session. And in the next session, we are going to talk about other things. Okay, so I also forgot about, I thought we ended on school age. Adolescents, the adolescents, these ones are good now. These ones, they are fully grown now. They are trying to discover themselves. They are scared of body image. You know, they want to look nice. They are insecure about compliments. If people say she's ugly, they feel bad. They try to do anything that can make them look nice. They want to wear nice clothes. Identity, you know, they want to also know their parents. They know me, I'm what, my mother is what. They also experience some peer pressure, because this age they are usually 13 years of age. Okay, 13 years of age. They fear pressure, what, and they also want their independence. They also want their privacy, in other words. Okay, they don't want that to be breached. Yeah, so that's it that we're going to do today. And you have some exercise down here. Just make sure that you answer them when you submit to me. We are going to discuss together just like you did. This is important that you do. These questions are just exam based questions, so make sure that you go through them. Bye bye.